I'm sorry for telling you to go, but this is a meeting.
Okay.
My speaker's not working, but it's not on.
Good afternoon, everyone. Welcome to our Early Childhood Provider Updates monthly webinar. The time is right after 1 o'clock. We'll give everyone about 1 more minute to log on, and then we'll go ahead and get started. We will go ahead and get started. The time now is 1:02. Good afternoon, everyone. I am Jenna Shasson, Assistant Superintendent for the Office of Teaching and Learning here at the Department of Education. Happy to host today's Early Childhood Provider Updates webinar. Today on our agenda, we have some COVID-19 updates, some updates on CCAP, licensing, business supports, teaching and learning. And then we have some special guest speakers today from the Budget Project here to talk to us today about the benefits cliff. So we are very excited to have guest speakers Stacey Roussel and Danny Mintz joining us today. So we'll get to that later on in today's webinar. But just a reminder, as we do every month, we are happy to take questions in the chat. So as we go through today's presentation, if you all have any questions, please feel free to put them in the chat as we move along, and we will pause at the end to answer any of your questions.
It's not the bus driver fault.
Just a reminder to please mute yourselves. If you're not muted, please go ahead and mute. Thank you. So we welcome you. Thank you all for joining us. And we will start by diving in to some COVID-19 updates for providers. Just a reminder of our COVID-19 resources located on our Louisiana Believes website, and they are accessible here on this slide. These are all clickable links. And a reminder that last month we did update our Office of Public Health guidelines for childcare. And we have some CCAP updates today. The first of which is around the CCAP pandemic application. So in response to the critical staffing shortages in acute care hospitals, we recently partnered with the Louisiana Department of Health to open CCAP pandemic applications to support essential hospital personnel in acute care hospital settings. The essential hospital personnel who are listed on this slide are those who are eligible for CCAP pandemic funding. To apply, essential hospital personnel must submit a completed CCAP pandemic protective services crisis application, along with a signed letter on hospital letterhead verifying their title and employment. We have been accepting applications, and we will continue to through October 31st of this year. Upon approval, certification for child care services will be valid for 12 months. If essential hospital personnel need child care beyond traditional center hours, such as nighttime care, the caregiver can become a CCAP certified in-home provider that will come into the home of the essential hospital personnel to provide care. We have received a large amount of CCAP pandemic applications, and our team is processing them as quickly as we can. So we're excited to be able to serve those workers. CCAP family redetermination extensions to ensure that our families continue to receive CCAP services despite the impacts of the pandemic and Hurricane Ida. Redetermination cases have been extended for a 3-month period. You can see here the timeline. September cases have been extended through December. October cases have been extended through January, and November cases have been extended through February. And just a note here that letters and notices will be mailed to CCAP participants and providers about this redetermination extension. We know that we have families who are experiencing homelessness as a result of Hurricane Ida. And so these families who are experiencing homelessness, who lack a fixed, regular, and adequate nighttime residence may qualify for CCAP for up to 12 months without evidence of employment and training activity requirements. They must apply for CCAP through us here at the department. Any questions about CCAP can be addressed by contacting us at the number on your screen or emailing ldecap@la.gov. We'll move next into a few licensing updates today. The first of which is about CPR and first aid certification. Per federal requirements effective September 30th, 2021, all early learning staff on the premises of a center and accessible to children shall have current certification in CPR infant, child, and adult, and in first aid. CPR PFA training can be completed online during the pandemic, but must include a visual demonstration by the instructor as well as a return demonstration to be observed by the instructor that is observable via Skype, Zoom, or another live platform. The department has created a list of approved CPR and PFA courses available through the link here on this slide. If you have any questions, please contact our Division of Licensing by phone at the number on your screen or by email at ldelicensing@la.gov. We also wanted to provide some updates about Bulletin 137 and Bulletin 139 revisions. Every 3 years, Bulletin 137 must be reviewed by a team of stakeholders to ensure regulations are current and to ensure they meet the needs of providers and requirements of the department. Therefore, we have recently revised Bulletin 137. Updates to Bulletin 139 were also made to be in compliance with federal requirements. Please note that these new versions do have an effective date of September 20th, 2021. In the next few weeks, we will schedule several provider trainings for licensed childcare centers and home providers. We will also have some blast emails and newsletters with additional information about these updates to these bulletins. And the department will require at least one person from each center to attend the training to learn about the updates to these bulletins. 2 continuing education hours will be given for attendance at these trainings. We'll move now into some business support updates. We know that many providers have experienced changing financial situations which directly impact their taxes. The department has contracted with professional tax consultants to provide tax support services to Type 3 providers. Early childhood trained tax professionals will provide up to 2 hours of tax consultation to a limited number of Type 3 providers. Services are now being offered. Consultation services will be available until June 30th or until contracted service hours are expended, whichever comes first. Type 3 providers, you can begin using the interest form that is linked here on this slide to schedule your consultation. And Type 3 providers can begin collecting financial documents to ensure the best use of their consultation time prior to your appointment. If you have any questions, you can contact shallon.jones@la.gov. The department has also partnered with First Children's Finance to offer a series of advanced level business trainings to Type 3 centers over the course of the next year. Topics include a wide variety of child care specific issues and will be hosted at 4 different times from now until March 2022. These trainings will be Pathways approved. You can register with First Children's Finance. The link is here on this slide. And if you need any more information, you can feel free to contact shalyn.jones@la.gov. The department is working to increase automation in centers to streamline time and attendance tracking and other operations, eventually connecting to the state's EdLink database. 8 vendors have been selected to be included in the CCMS guidebook. Type 3 childcare centers and CCAP certified family childcare providers will be eligible to participate in the initiative. In October, the department will release the CCMSI guidebook with more information about the vendors and the process for purchasing childcare management software, and additional supports will be provided in the following months. School readiness tax credits. The department is sending email notifications of star rating and levels to eligible directors by mid-October 2021. Director and staff member tax forms will be mailed by January 2022. For re-leveling with Louisiana Pathways career ladders, new credentials and certifications should be submitted before December 31st, 2021 to Louisiana Pathways. Directors and teachers with an expiring ancillary certificate must renew it 9 weeks before expiration via the Louisiana Department of Education's Educator Certification Portal. Childcare staff are strongly encouraged to begin submitting any re-leveling or renewal materials in October and November. Parent school readiness tax credit forms will be mailed to Type 3 centers by December 2021. And if you all have any questions about school readiness tax credits, you can feel free to contact demita.walker@la.gov. Teaching and learning updates. The LDOE has updated the Teaching Strategies Gold license to include both early childhood and the Office of Special Education programs within one new license for 2021-2022. Access to the previous gold license closed on August 31st, 2021. All documentation for 2021-2022 should be entered into the new license. Because users may have mistakenly entered data into the old license, Teaching Strategies will open up the previous license for a 48-hour period on Monday, October 18th. To allow teachers to gather any necessary documentation and reporting that was entered into the old license so that it can be moved to the new license. The LDOE will work with those networks that are severely impacted by Hurricane Ida and with any systems who have experienced a delay due to system changes this school year. The department will review BESI policy to ensure alignment with state law and will consider flexibility in timelines for administration and reporting results. We will also host a webinar for site-based administrators on Thursday, October 28th. Information for joining this webinar can be found on this slide. And if you need any additional information or if you have questions relating to gold, you can refer to the TS Gold guidance document or contact ecassessment@la.gov. We are very excited to announce that for the first time ever, we will have an early childhood teacher and an early childhood leader of the year awards. Our teachers and directors have shown incredible resilience, not just this year, but throughout the recent challenges our state has faced. If you would like to be recognized, or if you'd like to recognize another resilient educator for their hard work, dedication, and excellence in the field of early childhood education, please fill out or help someone fill out an application for these awards. The department will recognize the 2020-2021 Early Childhood Teacher and Leader of the Year for the first time. Eligible applicants are teachers and leaders serving children in Type 3 childcare centers, early Head Start or Head Start centers, or CCAP certified family childcare homes. The next slide shows a timeline for the Early Childhood Teacher and Leader of the Year award process. Applications will open on October 12th, with informational webinars held on October 20th and 21st. Applications will close on January 12th, and announcements will be made at the end of the current academic year. If you are interested in learning more about the 2021-2022 Early Childhood Teacher and Leader of the Year Awards and application process, please join one of our upcoming information sessions, which will include overviews of timelines, review of submission material examples and criteria, and question and answer sessions. These will be held on October 20th and October 21st. The information and the links to the webinars are here on this slide. We have an update next on performance profile release. The department anticipates releasing the 2020-2021 performance profiles by mid-November, including performance scores as well as informational metrics of best practices. These 2020-2021 performance profiles will reflect the flexibilities approved by BESI in April 2021 in response to the pandemic. The department will still publish performance scores based on 2020-2021 data when those scores were higher than the performance scores published in the fall of 2020. For all other sites, the department will extend 2019-2020 performance scores. The department will update all informational metrics for 2020-2021 performance profiles. If you have any questions about the upcoming performance profile release, you can email michael.bach@la.gov. And we have made it to the portion of today's webinar where we will welcome our guest speakers in just a few moments. We do, as I said earlier, have Stacy Roussel and Danny Mintz with us today from the Louisiana Budget Project, and we are just thrilled to have them on to talk a little bit more about the benefits cliff. You all who join us every month know that we've talked about this a little bit before in some of our previous webinars, but really excited to have some guest speakers speak today who are expert on the subject and able to explain it in more depth. The Louisiana Budget Project is a nonprofit organization that reports on public policy and how it affects Louisiana's low to moderate income families. Stacy Roussel serves as the policy director for the Louisiana Budget Project, and Danny Mintz serves as director of safety net policy. On the next slide, we will just review with everyone the teacher support grant and set up some of our purpose for our guest speakers today. We know that unique Louisiana data show that rates of teacher turnover are very high for early childhood educators, with 40% of childcare teachers leaving their site each year. And you all, our providers on the call, know this the most. We know that teacher workforce retention is one of the greatest challenges that you all face. Moreover, just 1/3 of teachers observed in Louisiana's publicly funded early childhood classrooms are still there 3 years later. Making sure that teachers are well compensated is a critical strategy to improve retention and ultimately program quality. We released an application in July and funds in August for a teacher support grant specifically designed to support teacher retention and recruitment. We will also be releasing an additional teacher support grant in 2022. Today, our guest speakers will share information about the supports for which your staff may be eligible, the income eligibility for particular benefits, and tips on potential matters to discuss with your staff before deciding how to make awards. So with that, I am happy to welcome on Stacy Roussel and Danny Mintz from the Budget Project to talk in a little more depth about the benefits cliff.
Hi, good afternoon. Thank you so much, Jenna, for the introduction and the opportunity to be here to speak with this group again. It's really an honor and a pleasure. I'll also start with a note of gratitude as the mother of small children, and I know Danny has young children as well. We have both benefited from the tremendous care that Louisiana provides through the early care and education centers. So just thank you all for the work that you do. And also for, I know, the rebuilding effort that we're all going through as we recover from another hurricane. With that said, I'm going to go ahead and jump into a little bit more of the information that we want to present today on the benefit cliff. The slide that I am showing, very good, thank you so much. You can go ahead and bring up all of the text. When we talk about the benefit cliff, of course, we're talking about public benefits that many of your families and employees may be entitled to and may be currently receiving. When a household earning increases just enough to bring a family above the threshold of eligibility for a public benefit program, it can result in a very abrupt and disruptive loss of benefit. The key here is for you to be aware, and of course, for those who are receiving bonuses and stipends to be aware of that cliff and how to mitigate that. If the wage increase is insufficient to cover the loss of replacing the benefit, that's where we want to make sure that everyone who is receiving that benefit is aware and can plan accordingly. Employers and staff members do not always understand what benefits, if any, may be lost with a wage increase, and the uncertainty can make career decisions difficult. The needed increased supports to teachers from childcare leaders may result in unintended negative consequences without communication upfront. Next slide, please. In Louisiana and within the industry of early care and education, public benefits can serve an incredibly important role. They can help staff members to make ends meet. Typically, many of the benefit programs that we're going to talk about today, the eligibility threshold hovers somewhere between 1% and 200% of the federal poverty level. Depending on the number of people in the household and the total income and other factors, some staff members may be eligible for and may receive some of the public benefits that we'll talk about today. There are different eligibility standards for different benefit programs. Next slide, please. My colleague Danny is going to talk about the different programs that we're going to cover today and go into some detail of those. So Danny?
Hi, so I just want to echo Stacy's sentiments, thanking everyone for the work that you do every day with Louisiana's children. And from my own family's perspective, as a family that has benefited greatly from the support of this is not an all-inclusive list of the public that teachers in your center receive, but it identifies some of the benefits we thought it was important for you to be aware of, particularly in conversations with your teachers as you decide how you may wish to provide the benefit to staff, whether as a single lump sum stipend or as a wage increase that they see periodically. The programs that we're focusing on today are SNAP, formerly called food stamps, Medicaid, and CHIP-LA-CHIP, which are both health benefit programs. LA-CHIP is the health benefit program for Louisiana children who do not receive Medicaid, but who income qualify for state health insurance. Section 8 is a housing assistance program. CCAP, I think you're very familiar with on this call. TANF, or as it's called in Louisiana, FITAP, the Family Independence Temporary Assistance Program, which provides cash assistance to low-income households with children, and LAHEAP, the Low-Income Home Energy Assistance Program that provides utilities assistance for eligible households. So this slide provides sort of a broad overview of the income levels that qualify a household for a particular benefit. There are two high-level observations I want to make here. One is that across the programs that we're looking at, there are a variety of different eligibility standards. And with LAHEAP and Section 8 housing, there's variation even within the state of Louisiana. Based on local economic conditions. Section 8 housing assistance is tied to the median family income in a given local area, and LAHEAP is tied not to local income variation, but rather to 60% of the median income in the state, which is a slightly different number than the federal poverty level figure that SNAP, Medicaid, and LACHIP used to determine eligibility. We've also included what these different categories translate into in actual dollar figures. So for SNAP, for example, for a family of 3, eligibility cuts off in Louisiana after a little bit over $29,000 per year in annual income. For a family of 4, with higher costs of living, the eligibility threshold is higher. It's a little over $35,000 a year. Medicaid is right around that level, but slightly higher as well. And LACHIP is higher still. The critically important point here, particularly with relation to SNAP benefits, is that a single lump sum support grant is not counted as income for the SNAP program. So if looking at whether a particular teacher might lose a benefit that's valuable to them if they receive a wage subsidy, if it's given, at least for the purposes of SNAP, as a single lump sum amount, then that shouldn't affect their eligibility for SNAP benefits. In general, and as a general rule, because variability in income eligibility thresholds for different programs, and because teachers make different amounts, the most important that we want for today, the particular mix of benefits, the possibility that receiving additional benefits receiving additional wages might cut the benefits. And so what we want to emphasize is that if you're able to talk with your concerns you may have regarding to receive some amount of additional wages would affect their benefits eligibility, they're probably going the best experts at knowing which particular programs you may want to be aware of. And
All right.
Stacy, I think I'm having internet connection issues, so I'm going to pass the microphone over to you. I'll respond to any questions or comments in the chat.
Thank you, Danny. This do happen at the most inopportune times, but to reiterate what I think one of the main points that Danny was making specific to SNAP is that currently in the state of Louisiana, a lump sum payment is not counted as income in SNAP. And so that's not going to count toward eligibility thresholds for the federal poverty level. So that's an important distinction for that program. When we think about benefit programs, one of the ways that you might kind of engage in discussion and think about these programs is that some of them function like a cliff. You either have it or you don't, and others are tapered off. so that once you reach the end of eligibility, the decrease in benefit is much smaller than if you were at the highest end of eligibility. And so understanding if the benefit is tapered or not can be helpful in understanding the extent of the impact. One of the other things to be mindful of is if there's a waiting list for a benefit. And so as Danny talked about, Section 8 housing assistance, a number of these programs are just not funded sufficiently at the federal level and some at the state level to supply the amount of demand that we have. And so if a person is eligible for a program that has a waiting list and they are currently receiving the benefit, the loss of that benefit could take a while to replace. So that's some of the other things that you want to just talk with people about. Generally, I find that individuals who have been able to gain access to those types of programs are aware of the benefit and they know the parameters and can talk with you about them. So we're going to talk a little bit about health insurance. Health insurance is such an incredibly vital benefit, especially today as we're all navigating a public health emergency. And amid that emergency, there have been some changes made to health insurance that's available to individuals. So hopefully you're all familiar with the Medicaid program here in Louisiana. In 2016, we expanded Medicaid to low-income adults. And so any of your employees who may have eligibility for Medicaid can enroll. It is an open enrollment program. And so if someone is below 138% of poverty for their household size, they are eligible. And there is not a waiting list. Now, if you have employees who are not eligible for Medicaid, perhaps they make 150% to 200% of poverty, and do not have access to health insurance through you as an employer, then they can go to the marketplace. Now, in previous years, people may have gone to the marketplace, to healthcare.gov, to look at the health insurance that they could purchase individually, and it may have been out of reach. Those premiums, deductibles, and copays can be very expensive. But under the under the American Rescue Plan Act, we have much, much greater federal subsidies going out to low-income households in the marketplace. So, for example, if an employee had been at 150% of poverty and logged in to healthcare.gov a couple of years ago, they would have seen a premium that was about 4% of their income. And for many folks, that is just too much. Under the enhanced subsidies that are there now, they would have 0 in premiums. And if they're just right over 150% of poverty, you could look at monthly premiums that were as low as $10, $20, $30 a month. There are also subsidies that are available for the copays and deductibles that come with those plans. So I encourage you, if you have employees or even parents who are uninsured, to look and see if they qualify for Medicaid, and if not, to please look at the marketplace. We also have new navigators that have been hired in the state of Louisiana to help people through this process. We know it can be daunting to look at health insurance. And so I'm going to provide a phone number, since this is being recorded, to the Navigator program for the state that people can call and find out what health insurance may be available to them. This is the Southwest Louisiana Health Education Center, but it's available across the state. And that's 1-800-435-2432, and we'll provide that as well. Open enrollment for the marketplace begins November 1st. So if you do have uninsured staff members who are interested in exploring this health insurance benefit, they can do so now, and the open enrollment, like I said, starts November 1. Next slide, please. We know that this is a lot of information to take in and that public benefits programs can be a lot to navigate. So we did want to provide a desk reference for you of the federal poverty level by household size for annual income. And then these are estimates below it for hourly income, if that's a little bit easier for discussion purposes and thinking through how to structure this pay. Next slide, please. And so as we kind of pause and just think about the different approaches that you may take in talking to your staff about lump sum payments and bonuses versus an hourly increase in wage, the most important thing is talking to your staff honestly and openly about what benefits they may be eligible for and currently receiving, or perhaps eligible for and not receiving. And of course, the eligibility is based not only on income, but the household size. And so you'll want to talk with them about that. You can also provide this information that we've provided to you about the marketplace, about SNAP, and just understand a little bit about the programs and where they can go for more information about those programs. Next slide, please. I'm going to pause and just see if Danny is back and available to talk about these slides, or if I should continue on.
I am here, and I'm going to leave my video off and see if that helps. So when we're thinking about the overall purpose of this presentation is to make sure that you're aware of some issues that may in some circumstances arise with some of your staff who are eligible for the bonus or wage supplement that your facility can offer through this grant program. I think there are two takeaways that are really important to have in mind. One is, again, that every staff member's situation is going to be different. And what we hope to have given you today is information that will help you to understand the context for questions that may come up with your staff. And that to the extent that you're able, communicating directly with your staff will probably be the most critical part of deciding whether there's a particular way that you want to issue benefits to your employees. Knowing the annual wage that you provide your employees and your employees' household size, if you're aware of that, perhaps through your own tax records, and how that relates to the federal poverty level, can help give you a better sense of whether your employees are likely to be in the ballpark of eligibility for the public benefits programs that we covered today. A one-time short-term increase in wages as a bonus rather than an hourly wage would minimize the way that the effect of benefits, the effect of this additional income for SNAP eligibility in particular, although this will still count as income for other public benefit programs. And finally, and this one, I know is difficult in practice, would be to ensure that the wage supplement is enough to cover the cost of lost public aid. I will say, as Stacy emphasized earlier, that losing eligibility for a housing subsidy is likely to have a greater impact than reduced eligibility or reduced benefit level for SNAP, for example, because as Stacy mentioned, with SNAP, benefits aren't an on or an off sort of thing, but rather they decrease in size as wages increase in general. Similarly, right now during the pandemic, because of enhanced subsidies for marketplace health plans, a transition from Medicaid coverage to a marketplace plan, while it would cause disruption certainly in terms of physician choice potentially and in-network coverage, would not have the same financial implications likely for your staff as it would have prior to the pandemic when subsidies were lower. Next slide, please. And just to cover these, the audience questions, the first question was, is a quarterly bonus considered a lump sum? This varies by program, but generally, yes. A bonus provided multiple times throughout the year. The first time it's provided, at least for SNAP, which is the program where the lump sum versus recurring payment has the most relevance. The first time it's the bonus is given, it's generally not counted as income, but once the agency is aware that this is a recurring payment, it gets averaged out over the several months of receipt. The second question is whether there is one central location that teachers can reach out to all of these programs, or do they apply for them separately? In general, they apply for programs separately. There are some programs that have a common application. SNAP, FITAP, and child support enforcement are all on the same portal. Medicaid is connected, but it's a separate application. But generally, if your staff are receiving multiple different public benefits, they're navigating different agencies, different applications, often different application timelines, unfortunately. And thank you for those questions. So finally, we wanted to cover additional financial resources for teachers. And Stacy, did you want to cover the information on this slide?
I certainly can. The question about accessing benefits and resources, I think, is incredibly timely and something that we would all just love to have a one-stop shop to cut down on what's required of folks to access these benefits to which they're entitled. But there is a great resource, and this is 211, where folks can call and get some information about different programs and referral. And so I would encourage you to just take advantage of that where you can. It's also a resource that is often deployed during disasters for folks who are newly eligible, newly exposed to hardship. And so there can be wait times, but I believe that this is a year-round resource, and even though there could be spikes in usage, that is still a good place to be able to reach out to. And of course, there are agencies that offer grants for first-time home buyers, free credit counseling, and other programs that can support financial stability. There are also just some fantastic legal aid programs if some of your teachers wind up stumbling into notices that they don't understand, or need some additional help. So just really encourage you to talk openly with your staff about these benefits. There are also, I'll mention, and Danny can speak to this a little bit more, because we are in a recovery situation again from a hurricane. DSNAP may be something that is also available, and I will pause there and see if Danny can speak a little bit to that, given the windows for application.
Yes, so this is something that applies now to the time that the call is being recorded. So if you are watching a recording, you can likely disregard this information. DSNAP for Hurricane Ida is ongoing, and these bonuses are unlikely to affect DSNAP eligibility if you are just starting to administer them now. DSNAP is a disaster food assistance program. The eligibility rules are a little bit different from the eligibility rules for SNAP. You can qualify with a higher income, particularly if you yourself have disaster-related damage that is associated with a high dollar amount. The way that DSNAP is calculated is that the DCFS, who administers the program, looks at your income and resources available to you, subtracts disaster-related expenses, and then makes a determination about whether you're eligible for benefits, DSNAP has been extended for all parishes. So if you are in an IDA affected parish and you, your staff, or members of your community may qualify for DSNAP, but were unable to get through the phone lines earlier in the process, or were unaware of the program, or for any other reason didn't call to apply, you will be able to call in and submit a DSNAP application over the phone between October 11th and October 13th. And that, again, is an emergency food assistance benefit that provides several $100s for grocery purchases to folks in areas of the 25 parish area affected by Hurricane Ida. So once again, DSNAP has been extended from October 11th through October 13th for all parishes. The call-in days are for people whose last names begin with A through L on October 11th, and those whose last names begin with the letter M through Z on the 12th, and for all last names in all affected parishes on October 13th. And thank you, Stacy, for that reminder about the program.
Certainly. I believe that concludes our portion of the presentation, and just thank you all again. I am incredibly heartened that some of this money is going to reach some of these incredible teachers and educators in our state, and thank you all for what you do for our children.
Thank you, Stacy. Thank you, Danny. That was a super informative and I'm sure very helpful presentation to a lot of our providers. Thank y'all for being on today and sharing that in such depth.
Thank you.
Thank you, our pleasure.
We'll move into just a few final updates before we close out today's webinar. I will take a minute and answer a few questions that have come in the chat as well. But wanted to let you all know today that the Louisiana Policy Institute for Children, in partnership with the United Way and resource and referral agencies across the state, is conducting a 5th survey to learn about how the COVID-19 outbreak is continuing to impact childcare providers in Louisiana. Participation in the survey will help with understanding what is happening in childcare in Louisiana, specifically in 2021. Findings from the earlier surveys were instrumental in informing recovery efforts and making the case for more help for the childcare sector. All providers are encouraged to complete this survey, answering as many questions as possible, even if you did not participate in the earlier surveys. You may complete the survey online by Wednesday, October 13th. I also wanted to give you all the date and time of our next monthly webinar. We will meet again on Thursday, November 4th at 1 p.m. using the link here on this slide. I will pause and answer a few questions that have come in the chat. One being around the CCAP pandemic applications. The question that we received is the CCAP pandemic funding only for nurses working in hospitals? And so just to clarify, this is not only for nurses. We worked in partnership with LDH to determine who were the best folks, who really would need this assistance at this time as pandemic response workers. And so in partnership with LDH, we were able to identify, as well as nurses, assistant nurses, EMTs, nutritional staff, therapists, mental health social workers and counselors, lab staff, and janitorial staff working in a critical care hospital setting. At this time, this is only for staff in acute care settings who are classified as Tier 1 and Tier 2 hospitals. This is in an effort to recruit and retain staff in these direct acute care settings. There is obviously limited funding for this, but we are really looking forward to being able to serve as many families as we can. We did have some questions around Bulletin 137. And we are making the changes in the actual Bulletin 137 document to be updated to reflect those updates and revisions. We had a question if the LDE key training modules and the DCFS mandated reporter training count towards continuing education hours. And the answer is yes, they do. Pausing to see if we have any more questions coming in to answer today. We were also asked if there is, or if there will be any additional LCAP grants. There will be another ARPA stabilization grant, and we'll be releasing that information and timeline soon. So yes, there will be an ARPA stabilization grant coming to providers, and we'll be updating you all on that as soon as we can. Okay, I think we had one more question about if a 16-year-old can be hired, and the answer is yes, a 16-year-old may be hired, but must be supervised at all times. Okay. And with that, we will close out today's webinar. You have contact info on your screen for licensing, CCAP, childcare provider certification, criminal background checks, and then of course, for any general early childhood support, earlychildhood@la.gov is the best way to reach us. Thank you all for joining this afternoon. Thank you for all that you do for the children and families of our state, and you all have a wonderful rest of your day. Thank you all for joining.